Hello all, this is Dr. Shilpi Reddy and we are talking about female sexual dysfunction. And in female sexual dysfunction, I'm going to talk about a very peculiar problem which is known as orgasm disorder. That can also be called as orgasmic disorders, wherein there is an intact, a sexual desire, sexual drive, sexual activity, but then there are difficulties in achieving an orgasm. And for women, basically, to get an orgasm is little difficult than the men. And there are different types of orgasms that we even look into. And when it comes to female sexual dysfunction, if there is a recurrent and persistent, failure of achieving an orgasm, that can be classified as one of the symptoms and signs of female sexual dysfunction. And female orgasms are varying type and intensity. When you have to talk about female orgasms, they can be the end of an act, or at times the woman gets multiple orgasms in a single act. So whenever she fails to get even a single orgasm in that act, that is one of the variety of female sexual dysfunction symptom, which is called as an orgasmic disorder. And even after sufficient sexual arousal and stimulation, if there is a thought block or derivation of the inference that she's not able to get orgasm, then that is one of the types of female sexual dysfunction. And that can be at times linked to pain also, that can be linked to their own fascinations, that can be linked to difference of thoughts at the moment. If she's well occupied in her subconscious about, she's thinking about something else, at times she's not able to have an orgasm. And at times before the woman reaches an orgasm, the men finishes off an orgasm, and again due to underperformance of the men also, there can be a persistent female aspect of an orgasmic disorder. That is a different aspect, and this is a different aspect. When it is persistent and recurrent, in spite of the act of intercourse and the act of performance, she's not able to get an orgasm, then that is known as a difficult in orgasm. So these again are at times very uncommon. The commonest what we see in terms of female sexual dysfunction is a lack of desire. The next common comes is the lack of arousal, and very rarely this is the next level of problem, like the lack of orgasmic disorder. So in these things also, organically there are a lot of problems. Maybe she's having multiple thoughts, maybe the location is not apt for her, she's not finding the environment friendly, or she's not happy with the relationship, or at times there are a lot of emotions and thoughts that are entering into her, not allowing her to have an orgasm, or there is any anatomical problem. There is another problem wherein sexual activity, if at all it is painful, that is called as a sexual pain disorder. In such conditions, whenever there is pain with the act of sexual stimulation or pain with the act of vaginal contact, again they have a female sexual dysfunction. When this thing happens, there are a lot of combination problems. And when you have pain as a problem, maybe because of infections, maybe because of anatomical problems of the entry of the vagina, or in the vaginal any infections are there, or there are any vaginal walls that are causing problems, any previous surgeries that have been very painful on the perineal area. So there can be several reasons, like endometriosis, adenomyosis, like pelvic congestion syndromes, like pelvic tuberculosis, like frozen pelvis like syndromes, wherein there is actual scarring of things that have happened in the pelvis which are causing pain. And usually sexual pain disorders are linked to some kind of a infection or a scarring that has happened into the pelvis because of various problems. And whenever there is pain, again there is withdrawal from the activity of sex, withdrawal from the activity of even having a desire. In such complex situations, even they can have orgasmic disorders, because they can bear the pain but they cannot get the orgasm at the end. So with pain, the pleasure is getting masked. So these kind of complex problems are there. So here comes the role of therapy and treatment when it comes to female sexual dysfunction. Most of these things are treatable by managing the environment, managing their thought process, managing their immediate environment and the partner's cooperation. And the female sexual dysfunction is definitely a concept of that can be dealt with ease.